Ever felt like you're on an emotional roller coaster you just can't get off? One day you're on top of the world, full of energy and ideas, and the next, you can barely get out of bed. If this sounds familiar, you might be interested in learning about bipolar disorder. It's more than just mood swings. It's a serious mental health condition that affects millions of people. Today, we're going to break down what bipolar disorder is, its causes, symptoms, and most importantly, how it's treated. So, what exactly is bipolar disorder? It's a condition characterized by extreme shifts in mood, energy, and activity levels. These shifts are much more severe than the normal ups and downs most people experience. There are two main poles, or episodes: manic or hypomanic episodes, and depressive episodes. A manic episode isn't just feeling happy, it's an incredibly elevated or irritable mood, lasting at least a week. People might feel overly confident, talk super fast, jump from one idea to another, and have a decreased need for sleep. They might also engage in risky behaviors, like spending sprees or reckless driving, because their judgment is impaired. Hypomania is a less severe version of this, with similar symptoms but not as extreme. On the other side of the coin is a major depressive episode. This is a period of at least 2 weeks of profound sadness, loss of interest in things you once enjoyed, and feelings of worthlessness or guilt. People might experience changes in sleep and appetite, have very little energy, and find it hard to concentrate. In severe cases, they might even have thoughts of self-harm. There are different types of bipolar disorder. Bipolar I is defined by at least one manic episode, which may be followed by hypomanic or depressive episodes. Bipolar II involves at least one hypomanic episode and one major depressive episode, but never a full manic episode. Then there's cyclotimic disorder, which involves many periods of hypomanic and depressive symptoms that aren't severe enough to be full episodes, but they last for at least 2 years. What causes bipolar disorder? The exact cause isn't known, but it's believed to be a combination of factors. Genetics play a big role. If you have a close relative with bipolar disorder, your risk is higher. It's also linked to brain structure and chemistry. Imbalances in naturally occurring brain chemicals called neurotransmitters are thought to be involved. Stressful life events, like trauma or a major loss, can also trigger a first episode in someone who is already genetically predisposed. So how is it diagnosed and treated? A proper diagnosis from a psychiatrist or mental health professional is crucial. They'll conduct a thorough evaluation, which might include a physical exam, interviews, and reviewing your mood history. Getting the right diagnosis is key, because the treatment for bipolar depression is different from regular depression. Treatment usually involves a combination of medication and therapy. Mood stabilizers are the cornerstone of long-term treatment to control manic and depressive episodes. Psychotherapy, like cognitive behavioral therapy or CBT, is also incredibly helpful. It teaches people how to identify and change troubling thoughts and behaviors, manage their symptoms, and cope with the stress of the illness. Lifestyle management is also important. Maintaining a regular sleep schedule, eating a healthy diet, and exercising can make a huge difference in stabilizing moods. Living with bipolar disorder can be challenging, but it's absolutely possible to lead a full and productive life. With the right treatment and support system, people can manage their symptoms effectively. If you or someone you know is struggling with these symptoms, please reach out for help. Talk to a doctor, a mental health professional, or a trusted friend or family member. There are resources available, and you don't have to go through this alone. If you're in a crisis, please call a helpline immediately. Thanks for watching today. Learning about these conditions helps us break the stigma and support those who need it. If you found this video helpful, please give it a thumbs up and subscribe for more content on mental health and well-being. Take care, and we'll see you in the next one.